Today we're going to show you how to measure cervical flexion and active range of motion. To start off with the testing position, you want the patient in a chair with a high backrest. This one's a bit low, but this is all I have now. And then to stabilize the patient, you want some type of strap, or we have a gait belt here. Again, it's a bit lower. It'd be more ideal if it came across the shoulders, because the point is to prevent them from tilting the shoulders forward and just capturing cervical flexion. You can have the patient just put their hands on their knees or whatever is comfortable, and explain to them you want to bend your head forward or bring your chin to your chest directly down, and to avoid any type of lateral flexion or rotation, so 100% forward bending. The infield for this position, can you just tilt forward? It's going to be a firm infield because of posterior ligaments of the neck, tension in various muscles, and then of course the joint capsules in the vertebrae. You can go back to neutral. The AAOS norm for flexion is 45 degrees, and this is the starting neutral position, and the anatomical landmarks we're going to use, I'll explain real quick. The fulcrum you want at the external auditory meatus. The stationary arm you want to have vertical, and then the moving arm will be at the base of the nares. So that's the starting position, and we'll get a starting measurement now at 90, and then you can ask the patient to basically bring their chin to their chest as far as they can without causing any pain. Have them hold it and then realign the goniometer and take the measurement. And when they do this, make sure they don't shift their shoulders or thorax forward, so it's straight cervical bending. So can you bring your chin to your chest, please, and not scoot forward? Good. And then you can put your hand back here on T1 to feel if there's any forward movement. So now she's here. We'll take another measurement, keeping this vertical, and then bring this to the base of the nair. We have about 30 degrees of flexion. You can go back to neutral. And then real quick, we'll just show the inclinometer. Put this at the base of the head. Zero it out. Ideally, you'd also have one at T1, and then you could subtract the difference. But I'll just put my finger here to feel any type of movement, and can you do the same thing? Tilt forward. Alright. And then we got 30 here as well. And that's it for cervical flexion with goniometer and inclinometer.